Got Dr. Daryl Ellis with us this morning. Great to see you this morning.
It's good to be here. Thanks again.
Thanks for rising early and coming in to talk with us too. And this is a great topic of conversation because start of a school year, a little bit of a reset button for a lot of folks. And so we want to talk about, doing some preventative care and the importance of establishing a relationship with a primary care provider. Tell us why an annual physical matters, maybe like a wellness check, and what happens at those types of visits?
Well, it's really kind of critical. We're just about to start fall camp and the college football season.
Yeah.
And I like to make the analogy of your primary care physician being like the quarterback for your football team. We're the ones who coordinate your care through the medical system. So that yearly checkup allows you and your physician not only to establish a relationship, but also to identify risk factors as well as potential problems that may require attention, whether it's at that office or whether it requires a referral to another specialist to be able to further diagnose and manage those clinical issues. During that yearly examination, you should get a complete physical examination, head-to-toe physical examination, to examine every orifice in your body. You should have your vital signs checked, you should get blood testing performed, and a new history if indeed there have been any changes in your medical history. Part of that, if you're establishing with a physician, is to do a thorough family history because genetics play a very important role in terms of risk for development of chronic conditions.
Hey, you mentioned football angle there. Nick Saban used to put his staff through a physical in the offseason, and it caught Steve Sarkisian, who's now the head coach at Texas, that he had a widowmaker and in that process. And so he was able to have bypass. He's alive today and thriving. So that's a big deal. Tell us some important numbers that we should all know and why routine monitoring is important over time.
Absolutely. Like I mentioned, vital signs need to be a specific part of your clinical examination, and they're called vital signs for a reason, because it's vital to know those numbers. Your blood pressure, your heart rate, whether or not you've run a temperature, make sure that your respiratory rate and your respiratory status is appropriate. If you're outside of the normal range in any of those numbers, those can be big clues that there's an underlying problem that needs to be further investigated. Also, as you're doing your regular blood work, there are certain markers that we look for as primary care physicians that can indicate, again, disease. Your glucose levels being elevated, your cholesterol or your lipid balance being out of whack, electrolytes being in the appropriate proportion, all of those things, and even renal function parameters as part of your usual routine screening laboratory studies.
Gotcha. We're getting up against the clock here. What are some early symptoms that folks brush off that maybe they should go and get checked out?
Yeah, lightheadedness, dizziness, chest discomfort, decrease in your functional ability. You get short of breath when you're doing things that you used to be able to accomplish without getting short of breath, excessive fatigue, difficulty with sleep. There are a bunch of little mild symptoms that some people say, well, I'm just getting older, so it's not that big of a deal. You are getting older, and that actually increases your risk for problems. So if you're starting to feel differently, you need to talk to your primary care doctor.
Yeah, sometimes a guy like me, I'm almost 40, but I got a baby at home, so I don't know if I'm tired or if I'm not well. That's why it's important to go to the doctor every year and check in as well. Great to see you this morning.
Absolutely. Thank you
so
for
much.
having me.
Bama fan, roll tide too.
Roll Tide.
Good luck this football season.
Thank you.
Let's send it over to Tyler. Good morning.